Well, the total number of reported COVID cases in the U.S. is quickly approaching 6 million. Cases are finally starting to fall across the Sun Belt, though, but former FDA Commissioner Dr. Scott Gottlieb says that the most concerning trend right now is that they are, quote, picking up in other parts of the country, particularly across the Midwest and the West, and especially in rural parts of the country. So Dr. Bob Lahita is in Paterson, New Jersey, and joins us now to break down the latest major medical news and developments and headlines, just clear things up for us. So, Doctor, first off, we're going to start with a tweet from the president over the weekend that Twitter actually removed. So it falsely claimed that only 6% of people listed by the CDC as having died from COVID-19 actually died from the virus. So what the president retweeted took a nugget of the truth that the CDC had posted, but failed to provide the broader context, because what the CDC was talking about was also the impact of comorbidities. So 6% was like trending on Twitter. Can you please explain this information that the CDC had put out?
Right. Well, let's talk about this a little bit, because this is important. First thing I want to say is that COVID-19 is not a hoax. I've been hearing that from a number of people. Secondly, the politicization of this virus infection is unfortunate. People with heart disease, diabetes, chronic lung disease, obesity, and hypertension could well live a long life if they were treated by their doctors, as they are, for many, many years. The fact that they die when they got the COVID-19 virus means that that virus has killed them, essentially, because these comorbidities, these conditions, can be managed by most of us physicians very successfully, so that somebody with diabetes can live a long life until their 90s. But if they're 75 years old, they have diabetes, and they get COVID, they die. So are you going to say that a diabetic with COVID is not a death from the virus? And the answer is no. The virus kills people, particularly those who are elderly, with comorbidities. It's very clear. So to make anything else of this is a lot of baloney.
This is coming out of the Financial Times. Apparently this weekend, the FDA Commissioner, Dr. Stephen Hahn, reportedly did an interview with the Financial Times. What he told them was that he would consider releasing a vaccine, should there be one that looks like it's good, before the phase 3 trials were completed, if it was felt that the vaccine would do more good than harm. Tell me your take on this. What are the possible dangers?
Well, Anne-Marie, if you shortcut anything, you have a number of risks involved. And we see that with the Russian vaccine, which is already out and being distributed in the former Soviet Union and its associated states. They did not even go into phase 3. Phase 3 is extremely important because it measures efficacy of the vaccine. That's how useful it is in different age groups, and whether a large population is going to have side effects, et cetera, et cetera. So we really have to be very, very careful. Emergency use authorization, which is what the FDA is talking about, is taking the vaccine, which is showing effectiveness, and giving it to people before it is officially approved. And now the problem we have here is that the CNN poll shows that 40% of Americans don't want to be vaccinated anyhow. And we know that there are a lot of people that are afraid, and there are a lot of people that don't want to be vaccinated. And if this is a two-part vaccination, that's even more concerning, because how likely is it that people are going to come back and have a second shot, especially if they got aches and pains after the first injection? So now we're seeing the FDA saying emergency use authorization. And that emergency use authorization might be appropriate for people at extreme risk that we talked about in our previous question, which was those who are extremely sick with comorbidities and who are likely to die if they get COVID-19.
Yeah, but you bring up a really important point about just in terms of people's confidence when it comes to this vaccine. And if you are somebody with a comorbidity, boy, you're going to have to really put your faith in medicine. And if you feel that the vaccine was rushed, And already, you know, the administration has bragged about how quickly this vaccine is going to go to market,
Yes.
you know, you may not feel so confident about taking it, and thus make yourself even more vulnerable.
That's
But let
exactly
us continue
right.
on. The U.S. has reported its first case of reinfection, and it comes just days after Hong Kong reported the first confirmed case of reinfection as well. Before, we were not sure. We suspected that there might have been reinfections, but what we're seeing now are cases that are very well documented. Also, other cases in Belgium and the Netherlands. What does this mean for immunity and vaccines against COVID-19?
Well, as an immunologist, we think this is a very rare event. It's not a very common event, or we would have been hearing about this left and right with all of the deaths and all of the 183,000 people who are dead in this country and all of the hundreds of thousands who are infected. It's definitely rare. But the unusual thing about the case in America of reinfection was that this individual got the infection sometime in mid-April, and then in May became infected with a different strain of the virus, which showed what we call genetic discordance. That is, that the virus had a defined genetic difference with the virus that he was infected with at the beginning. He unfortunately became quite ill after the second bout, showing respiratory symptoms, which is really dreadful, and getting very, very sick, and wound up in the hospital again. What happened with the guy from Hong Kong who went to Spain and had been reinfected the second time, his second infection was fine. He suffered some symptoms, but it wasn't as severe as the first infection. The same thing happened with the two people, one in Belgium and I believe one in France in Europe. They did not have they had the second infection, but they didn't have severe symptoms with the second infection. So it all comes down to your immune system and how your immune system is responding. Obviously, it responds robustly with the first infection, and then if you're reinfected, you should be protected with neutralizing antibody and a nice T lymphocyte response. In these patients who are infected the second time, that probably was not the case. There must have been a glitch somewhere in this very, very complicated system that we call the immune system. Anne-Marie?
Boy, oh boy. Dr. Bob Lahita, we could talk to you forever, but we are running out of time. But thank you so much. Really appreciate it.
Thank you, Anne-Marie.